Good morning. Thank you so much for joining our coffee conversations here at Forge Breast Cancer Survivor Center. We are so excited today to be delving more into this topic about the connection with breast cancer and stress and race and all of the things. We're very excited to have Keyonsis here with us this morning. She's going to tell us about herself in just a moment, but we're really excited about this presentation. She has a PowerPoint that she's put together for us to kind of help us follow along a little bit easier, and for that, we are very grateful. So please go ahead and press that button when you're ready. And but don't forget to tell us a little bit about you as we get all of this wealth of knowledge.
Thank you so much, Janata. Hi, everyone. My name is Keyonsis Hildreth, and I am a research coordinator here at UAB, working with Dr. Gabrielle Rocque on her health services team. And I'm a native of Selma, but I'm here in Birmingham now. I did my education at the University of Alabama, where I'm a two-time graduate, receiving my bachelor's and my master's. So roll tide and go Blazers. So yes, I am just so grateful for the opportunity to just speak to you all a little bit about the relationship between race and stress in women with breast cancer. So I hope that you guys get a lot of enjoyment out of it. And I want it to be more so of a conversation. So yes, there will be some learning points in the presentation, but more so of a conversation and very engageful. So I'm excited to hear you all's opinions and your thoughts and just your outlook on this topic. So, alrighty, we can go ahead and get started. I'm going to share my screen now. All right, everyone. So I just want to talk about the relationship between race and stress in women with breast cancer. So, just starting off with some statistics that are surrounding breast cancer. So each year in the United States, there are 240,000 cases of breast cancer that are diagnosed for women, and 2,100 in men, and about 42,000 women and 500 men in the United States die of the disease each year. But from that, Black women have a higher rate of death from breast cancer than all other women, and this is from the Centers of Disease Control and Prevention. And then just want to talk a little bit about the rates that are in Jefferson County. So in 2021, there were 138.2 per 100,000 Black or non-Hispanic individuals that had a new rate of breast cancer. And then for there was 126.5 per 100,000 that were for white non-Hispanic women. And then in 2022, the breast cancer deaths for Jefferson County, there were 27.5 per 100,000 for Black women. And then there was 18.5 per 100,000 for white women. So we can see how the incident rate and the mortality rate of breast cancer in Jefferson County was higher for Black non-Hispanic women than they were for white non-Hispanic women. And now we're going to talk about stress, and which is also like the overall basis of the presentation. And I know that sometimes, I can be stressed, you guys can be stressed, and there can just be so many factors that can contribute to an individual's stress throughout the day. But I just want to provide you all with a formal term of what stress is, and this is from the World Health Organization. Stress is a state of worry or mental tension that can be caused by difficult situations. So I just want you guys to take a moment to think about a time where you've just really been in a difficult situation and how much that situation has induced stress. So there is some good stress and there is some bad stress, but overall stress is stress. And, it's also very important to note that not every individual experiences stress in the same way. So, an individual's personal and social health stress, in addition to the seriousness of the stressor, can affect the ability of the individual to cope with that resulting stress. So this is one of the teasers that I was talking to you guys about so it can be like more engageful. So what are some factors that you all can think about that could induce stress for patients with breast cancer? So maybe two individuals could come off of mute and say what are some factors that you guys could think about that could induce stress, or even if you want to type it in the chat and I can read it from the chat from there.
Living alone.
Mm-hmm. Definitely can agree with that. Did you say living alone? Okay, gotcha.
Yes.
So I can definitely see how that could be a stressful factor because you're having the burden of having to figure everything out on your own, not having help and just having to do everything yourself. Okay. What else do you guys think could be some factors?
Finances or money.
Finances or
Money.
money? Yes, absolutely. Yes, yes, yes. I think that is probably one of the number one things that not just patients with breast cancer can face, just anyone that, has medical issues or things of that nature. I think that is one of the main things that they may come across when going through their journey. So yes, definitely finances. All right, thank you so much. So, in addition to the great examples that you all provided, here are some other examples or factors that can lead to stress. We have exposure to certain environmental conditions, we have adversity, family history. Some individuals are already predisposed to the disease. We have inequities to in the social determinants of health. We have discrimination, poverty, and other serious health issues. Alrighty, we have another teaser right here. So, are there ways that we can measure stress in the body? Do we think that there are ways that we can measure stress in the body?
I think so. I think it comes in many different ways for some individuals, like whether you're sleeping too much or you're not sleeping enough, or you're
Right.
under or overeating, things like that.
Absolutely. Thank you so much for that. And the simple question to that is yes, there are ways that we can measure stress in the body. But first, before we talk about how we can measure that stress, what what are some things that we could get from this image? What are some things that your mind would go to when thinking about what this image describes? Could we assume that an individual may has had some mental wear and tear?
For
Mm-hmm.
sure. Hmm.
Or could it simply be like a tug of war on the mental, you know? But that is definitely one of the ways that stress is measured in the body, you know. But in simple terms, the way that we can measure stress in the body in research is allostatic load. And allostatic load, it refers to the overall burden of chronic stress and life events. Um, excuse me, and it can be described in simple terms as the body's way of keeping score. So you know how Miss Holt, she said that the body, if you're not getting enough sleep, that's a way of your body keeping score, like, okay, I may be stressed because I'm not getting enough sleep. But in other words, allostatic load, it just provides a framework to develop and measure the biological effects of factors on breast cancer diagnosis, treatment, and survival. And the biological stress is measured by using multiple lab values such as the stress hormone, body fat, body weight, blood sugar, blood pressure, and waist measurements. So if you're going to a routine visit, these are some of the things that your that when you have labs, these are some things of ways that we can measure allostatic load through these multiple lab values. But currently, research shows that these lab values that are used to measure stress are higher for women with a history of breast cancer as compared to the general population. But in turn, this can help us understand the disease, treatment response, and survival rates. And in a study of 188 women, African American women were twice as likely to develop higher stress levels than white American women. And the biological toll of breast cancer, it may be greater in Black women than white women. And also, Black women tend to experience higher mental stress than non-Hispanic white women in the United States. But there was no association between a history of breast cancer and high stress in white women. So why do we think that? Why do we think maybe Black women experience higher mental stress than white women? Or why do we think there's no association between a history of breast cancer and stress in white women?
I think it could be many things. I think that it could be um, lack of awareness. For some people, they're very ill-equipped to understand breast cancer.
Mm-hmm.
I think that cultural differences, of course, just how we consume information and how we view things, can also kind of just determine, well, if I hear that I have a diagnosis that I don't understand, what does that mean? What does that mean for my faith and all of those things? Could be a component as to why the stress could be higher depending on the person's race or ethnic background.
Right. Absolutely. Anybody else have any thoughts on this? Alrighty. And then more women with a history of breast cancer have experienced distress at higher levels than the general population. So studies show that the stress response has been linked to poor cancer-related outcomes in patients with breast cancer. So we can see that on this graph. We have white women. There's only been 20% of those women that have experienced stress, but we can see that Black women that are less than 50 years old, almost 40% of those individuals have experienced higher stress than the white women. Now, are there other factors that can increase stress in the body? Yes. What about where we live? How many of you all have thought about whether the environment in which you reside affects your health? And do you all feel like the environment does affect your health? Absolutely. So this is another teaser question. So if we look when we look at these pictures on the left, what might come to mind when we think about how health outcomes? Like what health outcomes would you expect to come out of this picture that is depicted on the left-hand side? Maybe some adverse health effects. And then what about the right side? We could assume that, maybe there aren't as many adverse health effects that an individual may experience as compared to the left-hand side. And then one study showed that breast cancer patients that lived in higher areas of disadvantage were more likely to be younger and non-Hispanic Black individuals, have more aggressive tumors, and have increased stress levels, also allostatic load. And then the higher areas of disadvantage were also associated with more negative health outcomes among breast cancer patients, such as later stage of diagnosis, less than the highest quality of treatment, and lower survival in women with advanced breast cancer. Now, what about mental health? Compared to white breast cancer survivors, Black breast cancer survivors had worse emotional outcomes related to cancer-related distress, intrusive thoughts about cancer diagnosis and treatment, perceived stress, emotional fatigue, and stamina. And then for white women, distress-related symptoms improved from the time of their diagnosis to 6 months post-treatment, and symptoms remained stable between 6 to 18 months. But for Black women, they had persistently elevated distress even 18 months after finishing treatment. So even after these women finished treatment, they still had elevated distress levels, and they reported more avoidance of cancer-related thoughts and emotions across visits. Data also revealed that even after treatment, Black breast cancer survivors may experience lingering mental symptoms that can diminish their quality of life and even increase the risk of cancer recurrence. But if left untreated, Black women's high distress levels may contribute to poorer health throughout survivorship. And then after adjusting for age, income, education, insurance type, smoking status, alcohol intake, and physical activity, elevated stress in Black women was significantly higher compared to white women. And then on the next slide, I'll talk about how the social determinants of health all impact each one of these. So here's some concerns that patients with breast cancer may have. So we can see that the income is compared with the economic stability. With my breast cancer diagnosis, am I able to take off of work for doctor's visits? Education in education. Am I equipped with the necessary resources that will educate me to understand my treatment options? Insurance type, which will be attributed to health and healthcare. Will my insurance cover copays and my treatment? Smoking status, alcohol intake, which can be linked to social and community context. Does the setting that I live and work in increase the risk for developing worsened cancer outcomes? And physical activity, neighborhood, and built environment. Do parks or safe areas exist for daily exercise? So the boiling question is, what can we do to help individuals cope with stress as they are going through their cancer journey? And the number one thing we can do is provide resources. Here at UAB, there's a psycho-oncology program that supports mental health for patients with cancer with Dr. Sylvia Hong. Forge, which supports, empowers, and improves medical access and outcomes for Alabama breast cancer patients, survivors, and those who love them from the day of their diagnosis to the rest of their life. You also have Susan G. Komen here, and the American Cancer Society. Well, Susan G. Komen, they answer questions about your breast cancer risk. They provide emotional support and guidance in addressing feelings and other concerns. And they also provide financial assistance and connection to patient navigators. And here at the University of Alabama, we're currently doing a study which is promoting resilience in women with breast cancer. And within that will be an intervention that the participants will participate that includes 6 coaching sessions that help to improve resilience, psychological distress, hope, quality of life. But to summarize, stress or allostatic load is higher in Black or African American women than Caucasian women. Factors that can contribute to increased stress in the body include living environment, biological factors, and an individual's overall mental well-being. And then we must do our part in providing these individuals with the resources that can help them cope with stress while they're going through their cancer journey, and let them know that you are not alone and there are people here that will be able to help you and that are willing to help. So now I just want to take the time to acknowledge Dr. Gabrielle Rocque, who is the principal investigator for this project, who has entrusted in me to do this presentation for you all, as well as all of the other collaborators who have made this project what it is. And I know we're going to do questions afterwards. And I want to thank you and leave you all with my contact information. If you all have any questions, please, please, please reach out to me, or even if you just want to hear a little bit more about what we're doing in the area. So, thank you. Thank you.
Thank you.